Hello everybody, I got into one of the top 20 PA programs at the age of 20 and I wanted to dedicate this video to my patient care experiences and many other aspects of my application that I believe were my strengths and really leveled me up as an applicant. And I wanted to share my experiences as a way to give aspiring PA students inspiration, or if you're just interested in what other people's journey look like. I am one guilty of that. I love seeing other people's successes and their progresses, especially getting into a tough aspect, which is applying to PA school and getting into it and also succeeding throughout it. So I love seeing other people's journeys, and doing so has allowed me to gain so many tips and so many just inspiration from these people, and I wanted to partake in it, but this time by sharing my own experiences. If you're new here, my name is Kushi, and I got into one of my top choice and my dream program as a first-time applicant, and I did apply during my last year of my undergraduate. So I am still completing my undergraduate degree as of now, and I graduate in a couple months and I start PA school about a month after. So delving into my patient care experience, let's start with one of my strongest, and I think that is my patient care experience. So my patient care experience journey has been very multifaceted, very versatile. I made it a priority to make sure that I was diversifying my portfolio, which this kind of takes us back to the history of the PA profession and why it was really founded. To really cut things short, the PA profession was founded because there was a scarcity of medical providers, and back then diseases were rampant and there was a lot of help needed, and there were people that had extensive amounts of medical knowledge but they didn't have the medical degree, sort of like people that are naturally or have acquired these education. Maybe they had a family member, or maybe they worked in a medical setting and they just gained immense amount of medical knowledge, but they didn't have the degree, so they weren't able to practice it. So when there was a scarcity and there were a lot of diseases and a lot of need for providers, these people stepped up to help the patients, and soon after there was this profession called physician assistants, or now that their name change is happening, physician associates, and they were founded. And so basically the history of PAs and their need arise from their diverse experiences and their way of being able to be adjustable and help out with multiple specialties. So I found that really fascinating, and I wanted to incorporate a lot of that into my experience. And before I begin, I do want to preface this by saying that this is just my way of sharing my experience to help other people get ideas for what they could potentially do and also gain some inspiration from it. I do not want this to be an avenue of where you compare yourself and make yourself feel bad based off of other people's experiences. PA programs accept uniqueness. They accept people that come from different backgrounds. So you may have the same GPA, the same patient care experience as another applicant, but what they do not have of you is your life and the different aspects of your life. So please know this. So please don't compare yourself to me or anybody else. This is your journey, and it is only your journey that you need to compare yourself to. So let's begin. My patient care experience started off by working as a CNA. So I initially started working as a CNA at the age of 16, which is really young, but I was able to do this by joining a medical internship program that my high school offered, which is quite rare, but I was quite privileged to have this opportunity. So I was able to gain multiple certifications early on and get into the workforce early on. So I worked as a CNA for a year and a half. I initially started off as a rehabilitation CNA, so I worked on the rehab floor and it was very hands-on. But as I continued working there throughout the months, I was getting floated to many other floors. I started working in the ICU, I started working in med surg, orthopedics, emergency. So I sort of was able to get a well-rounded experience working in these different floors, and I was able to expand my scope of practice by continuing to gain certifications and delving into wound care and the removal of catheters and all that like. So my CN experience working in an inpatient hospital truly was something that allowed me to become more hands-on and really get a grasp of what inpatient healthcare looked like. Then I proceeded by working as a medical assistant. I worked as a medical assistant for about 2 months, and it was sort of like a charity sort of project where it was a outpatient medical clinic owned by a nephrologist, and there were short staff, so I was free during the summer, so I just worked as a full-time medical assistant. And this allowed me to really understand what outpatient care looked like, and it is really a lot balanced. It usually is like a 9-to-5 job. And this time working as a medical assistant, I kind of had a twofold job. So on clinical days, I would take vital signs of the patient. I would, guide them to their room, do any pre-operative stuff that was needed. And on non-clinical days, I would usually look into patient charts, confirm appointments, and keep all that aspect of that clinic organized. And then after working as a medical assistant, I also had worked as a phlebotomist, and I worked as a phlebotomist for about a year. I worked in an inpatient hospital. My primary place to do this job was the emergency section of the hospital, and I did this during the weekend because I was in school at that time as well. So I used to work 12 hours during the weekends, and it was a really great experience. I also, as I continued to work more, they started floating me to other floors. So then I also started drawing blood in the ICU, med surg, and then the OBGYN floors as well. So it truly allowed me to really grasp what that kind of looked like as well. And then I also work as a pharmacy technician. So that just means I dispense medications, sometimes divulge into customer care, and understand more about how insurance plays a role, what sort of medications are for, and all that. I'm looking at my notes to see I don't miss anything. So yes, and I was able to gain all these patient care experiences by gaining multiple certifications. So I did get a EKG certification, medical assistant, certified nursing assistant, phlebotomist, pharmacy technician, and then all the basic CPR, BLS certifications, stop the bleed certifications. And if you're wondering where and how I got these certifications, I got them through NHA.com, and I will link it down in my bio in case you are also interested. They do have a online way of getting those certifications. I got my pharmacy technician and EKG technician online, and there wasn't really hands-on aspect. As for phlebotomist and medical assistant, I would definitely give it another check because since I was able to do it in person at my medical internship, I was able to have those dummy hands to stick the needles in, or my classmates. But given it's an online program, it probably has its sponsorships around in person where you can actually get that hands-on experience as well. So this is how I got my patient care experience and my multiple certifications, and I wanted to ensure that my portfolio was diverse. This doesn't have to be you, but I wanted to make sure I got into PA school as a first-time applicant, so I really was pushing myself to do the best I could. The second strongest aspect of my application would be my GPA. So when I was applying, my overall GPA was a 3.91 and my science GPA was a 4.0. Now, once again, don't compare yourself. I am someone who takes my academics very, very seriously, and getting anything less than an A really hurts me. But I also want to preface this by saying that I did put in a lot of work, especially in the prerequisites. I knew that, let me bring you into what my mindset is. So when you actually get into PA school, your first year, as everybody knows, is your didactic year, and then the second year is your clinical years where you go on rotations. Now, in the first year, there is an extensive amount of content to complete. And the program that I've gotten accepted into, they also incorporate volunteering and occasionally going to clinics and doing some hands-on stuff over there as well, so that when we actually arrive during the clinical years, we are prepared with the basic training, if that makes sense. So this means balancing coursework with volunteering work with the clinicals that we will be doing during the didactic year. And what most PA schools are looking for is your way of being able to time manage and your way of prioritizing how you should go through the tasks that you are given. Now, in undergraduate, sometimes it is easier as you have a dedicated amount of coursework and credits that you need to take, and sometimes people work, sometimes people don't work during their college careers. And I wanted to show the schools that I was capable of working multiple jobs and getting a high GPA, because PA school is much more difficult than that. This is not to discourage, this is just a way of me building my endurance for when I do get into PA school, that I am used to all these stressors. I wanted to get used to it before I actually put myself in that kind of environment. And most PA programs are looking for these kind of traits, that grit, that perseverance, that excelling in that time management. Those skills, most schools are looking for them in applicants, because not only do they want to increase the retention rate, which is to keep students in the program, but they also want to know that you are capable and you will push yourself no matter what the challenges are, and that you actually consider a challenge something that is fun and something that enables you to continue to gain more knowledge, rather than feeling defeated and feeling like maybe being a PA is not your path. They don't want people that are not sure of their capabilities. So as you go into your undergraduate career, as you go into patient care experiences, it is not easy. It is tough. There have been times where I have questioned if this is the career for me, but at the end of the day, it really was a fulfilling endeavor for me, and I feel like I was called for this path. So I really put in a lot of work for my prerequisites and my overall GPA. I made sure that I was able to understand the content and show the schools that I can multitask while getting good grades and excelling in many other aspects of my application as well. The third thing may not really be a more skill set based experience, but I wanted to list learning about the profession as one of the things that trended my application. So one way you can really learn this is by shadowing PAs, watching videos online and all the like. But you really need to know what a PA actually does. Most students sometimes consider PAs as those people that weren't able to get into medical school and this was their backup. PA programs do not want to hear this. They want you to choose the PA program on the merits of being a PA, on your merits, on how you can be a great PA. This is being a medical provider, right? So do some basic research like how I explained earlier on the video, where the foundation of PA began. You can use this in one of the answers, and I did in my interviews, and I think this shows the program that you have a certain kind of appreciation, and you're not just applying to these PA programs and join the profession for unknown reasons, but you rather actually have specific reasons. And this actually brings me to the fourth aspect of my application, which is shadowing experience. Now, when I initially was delving into my shadowing experience, I actually was hindered by the COVID-19 protocols and regulations. So this sort of limited my ability to make close relations with the PAs that I was shadowing, and in turn didn't allow me to get recommendation letters from the PAs, which this will be another video if you're interested. But I actually used this to my advantage. So since I wasn't able to make that close relationship with other PAs and get that quality shadowing hours, I decided, why don't I shadow other medical professions as well? So I shadowed physical therapists, respiratory therapists, doctors, nurses, nurse practitioners, and I used this to narrate my story in my favor by saying that when I shadowed these people or worked with these people, I observed what it is that they do and what kind of role they play in a healthcare. And while I respect what they do and I appreciate what they do, I felt like I was capable of doing more, and I wanted to play a more involved role and a more preventative role in the healthcare system. And being a PA allowed me to do that. Because as a PA, I can diagnose, I can treat the patient, I can provide treatment plans, prescribe medications, perform certain procedures, first assist in surgeries. So I play a more important, more involved role. And this sort of shows the programs that not only have I shadowed PAs and I know what they do, I've also shadowed other careers, and I have observed what they do, and even after knowing what they do, I chose the profession. This creates a level of certainty and shows the programs how dedicated I am to follow this profession. So if you are someone who is struggling with gaining shadowing hours, specifically with PAs, or you think you're not going to get a recommendation letter from a PA because you don't have that strong connection with them, know that there are other avenues and you can still get into your top choice or any PA program to that matter if you keep a positive outlook and use some of those weaknesses as your strengths. My fifth aspect of my application, I believe, would be research. So as I'm completing my undergraduate degree right now, I am involved in research. And as I am an honors student, my undergraduate university has this expectation from honors students that they conduct their own research, conduct their own experiments, make this whole paper, present it, and all that like. So this wasn't something that I was initially planned to strengthen my application. It just happened to be something, and I think it is very not overlooked at all. So research, let me backtrack. I'm kind of jumbling up my thoughts. But during PA school, during your last year, there is a capstone project. Essentially, it is where you research a disease and then you present it. And this involves really researching through primary sources, secondary sources, writing a paper, understanding what the different aspects of the paper is, how a research is conducted, and all this. And doing this in my undergraduate right now has allowed me to understand what conducting research really is like. And I think that strengthened my application in some aspects because I was able to show them that I am passionate, not only as being an honor student, but as I am a psychology major, I'm passionate about the degree that I chose and furthering that passion by conducting research. So I am conducting an experiment with participants and putting myself through all these protocols and regulations needed to get the approval for continuing with the research. And I try to emphasize this in the interviews, and I think it really was one of those factors where the admission members are like, yeah, wow, like she's really putting herself in these different avenues. And it was really a way for me to get out of my comfort zone. It isn't easy to just write papers and research papers specifically. It is a whole different language. And this also shows the school that I'm willing to go out of my comfort zone. One way was to show how I was gaining multiple certifications over content like EKG. It's difficult to understand heart rhythms, and at a young age too, and gaining all these experience and getting out of my comfort zone, working those 12-hour shifts and doing all these different aspects of my life. And this shows the school that I am not afraid and I don't shy away from challenges, and I'm open to adjusting and gaining more information, which is essentially the whole world of medicine. Medicine is ever evolving. Every year or every decade, there is a new discovery, there is a new machine, there is a new disease, or everything is new. And as a medical provider, it really is, as an aspiring medical provider, it really is our responsibility and duty to stay up to date and have fun with it. So research and conducting research is one way, and while I don't immensely enjoy it, it really is something that keeps me updated and allows me to be more involved. So if you are interested in research, or if you're doing research, please mention it when in your interviews or somewhere in your personal statement or in your supplementals. This is really a huge bonus, and not a lot of people have opportunities for that, but if you do, please mention it. One of the last aspects of my application cycle would be your extracurriculars, your hobbies. Now, being a PA, pre-PA, PA, or anybody who is in this medical world, you don't have to have your life consumed by medicine. You are more than that. So it is okay and actually encouraged to showcase your hobbies. Some of my hobbies, since childhood, I've been a dancer, so I did work as a dance instructor. And I love reading, I love cooking. I'm a vegetarian, so I'm constantly looking for new recipes or healthier recipes. And I love hiking, I love hanging out with my friends and my family, spending quality time with them, learning new skills. And you really want to at least touch on some of these topics during your interviews or your personal statements or supplementals, because outside of medicine, there are things that help keep you going. For some people, that is learning new makeup looks. For some people, that is outdoor sports. Some people, that may be painting or crocheting. These are some things that give you joy, and you want to make sure, and you actually want to show this to the admission members, that you actually have other avenues and that you are a well-balanced person. This is not to say that if you don't have specific hobbies, you are no good. That's not right. What I'm trying to say is everybody has something that brings them peace, and you want to show that. You don't want to show the school that you are only consumer medicine, even if that's your passion, real true passion. We could really convey that too. But what I'm trying to say is, when people have an unhealthy obsession or an unhealthy consumption from the medical world, it can really cause burnout sometimes when that's the only thing you know. Sometimes that repetition and that overwhelming amount of information can really make you feel tired and burnt out. So to ensure that you want to have hobbies for yourself, and you also want to showcase that to the schools, so that when you are in PA school, and if you have breaks or if you have free time, what would you do with it? Because if you study with it, you would potentially get burnt out, and PA schools don't want that, because in some way that can later on hinder your mental health or your learning capabilities or just your overall performance. And PA programs are encouraging and looking for your growth and succeeding. But there's only little they can do if you don't have those coping mechanisms set in place. So even though getting those patient care experiences and high GPA is important, it is equally important to take care of your mental health and take care of taking care and putting yourself in an environment where you enjoy, whether that is reading, dancing, eating, whatever that can be. So make sure you do talk about that. Next is other extracurriculars, like jobs that are not medically related. I was able to utilize this in my own experience by working as a peer mentor. This was really non-medical. I sort of just mentored freshman students that were also commuters, and since they weren't on campus very long and they would just go to their class and go back home, I was sort of there as a mentor to help them figure out how to handle their financial situations, or how to know where their classes are, or to know when the last day to add or drop their class was. And since they weren't hanging around with a lot of people that can easily give them access to that information, and since they're commuters, they might sort of be nervous to ask for information. As a mentor, I sort of guided them through it. This in turn allowed me to enhance my communication skills and understand body language more, and know where people really come from. So this, I was able to also narrate this into my personal statements and my applications, that this is how this experience, though not medically related, allowed me to become a better person, allowed me to grow personally and professionally and academically in some ways. And I was also a mental health ambassador for a mental health club, and this also sort of goes into an extension of my passion for being a psychology major. So these are some ways you can show your hobbies and things that you excel in, especially leadership roles. So I am a secretary for a pre-PA club, and this sort of puts me, strengthens me essentially, because now I am showing that I am actually passionate about the profession, and I'm using this passion to guide other students, aspiring PA students, and helping them through the application cycle, and giving more coverage on what this profession exactly is about. So don't shy away from your hobbies, things that make you happy, no matter how mundane they are or how rare or normal they are. It is a part of you. And in your application, your personal statement, your supplementals, they really give a insight into who you are as a person. So you really want to think about how you want the programs to view you. And GPA and the patient care experience, those can be matched. Some people may have similar experiences as you, but what they don't have is your mind. And you want to make sure that the programs get a good view and perspective, and you want to make sure that it favors and puts you in a positive light. So if you want to know more about how to write a strong personal statement and supplementals, let me know and I can make a video on that too. But that really, I think, covers most of what I wanted to talk about in my patient care experience. So thank you for listening, and I will see you in another video.